How to complete a change order for interventions or treatments in CanTime, also known as a change in care plan order. Again, the interventions or care plan in CanTime are what we refer to as the treatment record on paper. Okay, so you would complete the change order the same way you would a regular change order for medications. New order, change order, because I want to make a change to my care plan. So you'd select change in care plan. If you select change in care plan, the buttons appear below the order description, edit interventions and edit goals. Now you will be working with edit interventions. By selecting edit interventions, the edit interventions pop-up box will appear. You will see a list of all the current interventions for the patient. Okay. Now you can look for the one that you want to DC, or you can actually filter it out by area up here in the upper left-hand corner. You'll notice there is a discontinue date column here, but you do not have access to this save button. This is not where you DC. So even though you can add a date here, it will make no changes. To properly discontinue an intervention, you must first click on Edit on the far right hand corner. Now you might have to enlarge your screen, maximize your screen, or move all the way to the right in order to see the edit button. Okay, you'll have to click on the button, actually click on edit, not anywhere else here. Click on edit and the edit intervention pop-up box will appear. Again, you have a discontinue date box here, but you do not have access. It is grayed out until you check mark discontinued to verify that you do in fact want to discontinue this intervention. You click on discontinue and then add your DC date using the calendar option here. Then hit save. Once you do so, the date will pull here, and you may repeat the process as necessary for any other interventions that need to be discontinued. Just like you would for medications, it's best to DC the intervention first and then add your new one so that you do not forget to discontinue the old intervention. The next step in adding an intervention is clicking the button located on the top right-hand corner that says Add Interventions. You would select discipline SN, which stands for skilled nursing, and then select your area. In this example, we're going to do a nutrition order, so that would be gastrointestinal, or GI for short. When you select your area, you'll notice all the interventions listed here that are both used for the patient and not used for the patient. These are templates. These are already in the system and not in use for your patient at the moment. So you need to find one not in use, one of these templates. Anything that is not check marked, whether it's gray or white, you need one that is not check marked. Look for that one, check mark it, remove the entry that's there, because it's a template, we're not using it. Remove it completely by deleting the whole thing and then entering in the order as received by the physician. Once you type out the entire order, you would hit save. You'll notice that the effective start date of just this new intervention that you have added will have this effective start date located in the upper left-hand corner. If you need to add another intervention, you would repeat the process, looking for one that is not checkmarked, checkmark it, remove the entry, make it your own, and hit save. You are able to do a change order for both medications and care plan on the same order. You simply select both options for change in medication and change in care plan. If you've selected both, the care plan edit interventions button will be located well below the list of the medications. You have to scroll down in order to find it. You will repeat the process as we've learned in the first video for MD orders, and then repeat the process that you've learned here for care plan. Once all changes have been made, then autofill, make any necessary changes to your order description, and save and submit.